Good afternoon, everyone, and welcome to our another discussion. And today, our topic is in a bit of a crucial subject. I think if I say it won't be too much wrong. And I hope many of you must have seen already. There is a current government, Labour government, is bringing up a bill which is known as our Natural Health Supplement Regulatory Bill. So what this bill is and how it is going to impact everyone who is keen at some stage in their life to follow more and more holistic approach to their well-being, and how it impacts the practitioner also, those who are practicing natural medicine, whether they are naturopath, herbalist or Ayurvedic practitioners or other kind of. And even it is going to impact the simple consumer in their day-to-day life, because what this bill is talking about, regulating even your cinnamon and your turmeric and aloe vera or other kind of such simple herbs. So first of all, we need to know what this bill is all about and why government is bringing up this regulation. Now, as far as we talk about the regulation, I can say we all should fully endorse and support the regulation for the quality control and a good product in public's hand, because the safety and the well-being of our community is the foremost factor and should be for everyone, every practitioner also. And that's not a question at all to compromise. But at the same time, we all know there is already more than sufficient regulations and watchdog kind of situation for all such products to be getting into consumer's hand after going through all those vigorous and rigorous tests and inspections. So what is the need of bringing up this extra regulation? And even government is not very clear on that who will be the regulatory person, who will regulate them. The way, if you all read about this bill, it seems that they will be giving this in the hand of our mainstream medicine, Western medicine practitioner, or someone will come up and they will become the regulator. And then there is no guideline that on what parameter they wanted to regulate. So all those things are clearly indicating that this government does not want natural medicines to be part of our public need for well-being, in spite of the fact that what we have seen in these last 3 years, and not only in New Zealand, all over the world, we all have seen that how our mainstream medical system has failed to protect the life of all, in spite of having everything at their disposal, at their fingertips, all the new inventions always with them, but still we have millions of people who have died all over the world from this COVID situation, which has made everyone to think clearly that yes, Western medicine has its own role, but there are so many gaps which cannot be filled by our Western medicine, and that's where the role of a holistic approach to well-being come up, and that's where the approach of natural herbal medicines comes up, which has the ability to correct the core cause of the problem and not just supplementing if any function is not happening in the body, and then don't worry about that organ and just take supplement. That's not the approach what we are advocating for. So from our perspective, and sharing with all of you who are somehow associated with Ayurveda, that we all should individually, collectively, should protest against this bill, but while we all should endorse that there should be regulations, but regulation instead of product, we all should vocally talk about that there should be regulation about the qualification of the practitioners, because as you all know, these all modalities are what we call as self-regulatory, and there is no standards of and for anyone to practice, that what level they can practice, what qualification they should have, what are the teacher's qualification, what will be the course content. Even though every college has their own sort of parameters, but still people can come and sit out, if they are good in marketing, to start practicing as a naturopath, as a herbalist, as an Ayurvedic practitioner, Chinese medicine practitioner, and no one can stop them. And we all see that a lot of medical doctors, they will just do a one weekend course in Chinese medicine or so, and then will start talking about themselves as an acupuncturist. Means we need to understand that each of these modalities are different. Each one has their own strength and system. Just by being a medical doctor does not give you the certificate that you should be able to practice every modality. So that's one part we are going to talk about, that there should be a regulation in the qualifications of the person who is practicing that. Then regulation of the product, as I said, is already there. There are specific regulation in Australia where the TGA is the authority that no product can come in the market, no product can go on the shelf if it does not have a TGA listed number. So, and we all know how strong and how rigid or strict regulation TGA authority is having for the testing and the manufacturing of these products before they get the list number and the license number. So on those notes, that part I think should be highlighted to these authorities, that there is no such need to add some extra layer of scrutinizing these herbs, which will only add extra cost to the end consumer and will make many people who can't afford that level of fees or testing part, which is not required because they will be getting that done beforehand anyway, so they will be adding more and more of these extra layer, which will make end product out of the hand of a common user who will be using either it is the turmeric or the aloe vera or other kind of herb. So I thought I will share with all of you that we must have a common voice to oppose this bill in its current state, while we all should say that we endorse the regulation and the quality control but unnecessarily regulation, and by those people who have no understanding on these natural products, becoming a watchdog will be of no use. So that's the message I thought I will share with you all quickly. And if everyone can go and make a submission, that can be done through going on the website of the parliamentary, I think, board. And I hope many of you already must have seen the links, and other thing has gone through many emails. And we'll appreciate your support for this cause, and it will help to survive our natural medicines, and then it will also protect your right to have a right to choose what you feel is appropriate for you, and not like what we have seen in our COVID part, that they force everyone to get into vaccine, whether some want or not, due to many reasons. So this is where this government is going, and we should definitely stand for it and protect our right and our natural product. Thanks everyone.